C-section scar massage or mobilization. That's what I'm going to be going over here. So we're just going to pretend I'm just going to do this on my lower abs. I have not had a C-section, so I don't have a scar, but I'm going to just pretend that I have one down here to show you some of these techniques. So once the scar is fully healed, typically about 6 to 8 weeks postpartum, everybody's different. Some heal much quicker, some take a little bit longer. Once the scar is fully healed, there's no signs of infection or anything, it is a good idea to start touching the scar and get it moving. So what can happen if we don't touch the scar is over time, the scar can adhere to other tissues, and you have organs that sit beneath where that scar is, your bladder, your uterus, and so it can form adhesions. It can also limit your ability to turn on your lower abdominals, that transverse abdominis muscle, which is very important for core stability. So we really want to get the scar moving to prevent other issues like urinary frequency or urgency, where you have an urge to go to the bathroom, other pelvic floor issues, prevent a diastasis from healing. So it's very important to get this scar moving when you're comfortable, okay? So once it's fully healed and you feel comfortable touching that scar, okay? If you haven't even touched your scar yet, then that's a good first place to start. So if you haven't touched your scar, before you do any massage or mobilization, I just want you to apply maybe gentle pressure, just light, just kind of touch the scar. And if you can't tolerate that, start with the area around the scar. So touch all the skin around it, and then once you're comfortable with that, maybe then you can touch the scar. If either of those, if you're not comfortable with that yet even, then maybe try touching your scar through clothes. So maybe if you have high-waisted leggings, maybe you have your leggings all the way up and you start there by touching your scar through your clothes. And then once that becomes more comfortable, you spend some time on that, then you can go back to trying it directly over the scar and the skin around the scar. So once you're comfortable touching the scar, then we want to start getting it moving. So some different techniques. So I like to use the pads of my fingers. Okay, so I'm going to start by just showing you just some light pressure across the scar, so you can go in all directions. But what I'm going to start with is I've got 2 fingertips here. You're going to go directly over the scar. You're going to apply as much pressure as you can tolerate. You're going to start light, and then as you get more comfortable, you can go with more pressure. But you're just going to go up and down all along the scar, up and down, and then on the way back, I'm going to do circles. So you can do circles in both directions over the scar. So we want to get this scar moving in all directions. What happens when a scar is healing is you have all these collagen fibers, and they're all kind of laid down in a disorganized way. And so to help the scar heal, mobilizing and massaging the scar can help those collagen fibers lay down like they're supposed to, so that we have a strong tissue that's fully healed and not all crazy fibers everywhere. Okay, so that's what this can help. So you can do circles, you can go at a diagonal up and down across the scar, all the way across. So move all across that scar. You want to get every area. Okay, so you're going to go light pressure to more, and adding more pressure as you can tolerate. You're going to go up and down, side to side, circles clockwise, counterclockwise, diagonal, diagonal. You're going to go in all directions, all across that scar. Okay, so then add more pressure if you feel comfortable with that. You can also do a stretching of the tissue. So you can I have my same thing, 2 fingertips, and then I'm going all on the scar, and I'm just kind of stretching the tissue in different directions as I move along the scar. Okay, so that's another technique you can do, just kind of stretching that tissue. And then a more aggressive technique is skin rolling. So basically you're going to pinch and lift your skin between your thumb and index finger, or you can have your thumb, index, and middle finger, but you're pinching here, so you can see that I'm pinching and lifting, and then I'm going to just roll my fingers all along that tissue. Okay, so if that's really tight, it might be hard to roll completely all along the tissue. So then what you can actually do is just pick it up and lift it, move it up and down, side to side, circles one way, circles the other way, and then move on to the next piece of the scar. Again, up and down, side to side, circles and circles. But here we're actually pinching and lifting the tissues, which can really help if there's any adhesions or scar tissue formation beneath the scar, kind of with all the organs and muscles and tissues that sit underneath it. So you're pinching and lifting as much as you can tolerate. move in all directions, diagonals, circles, side to side, and do that all along the scar. So that's a more aggressive technique, the skin rolling. Something you could also do is work with your provider, your pelvic floor therapist, to help you with cupping along the scar. So that's another option if you're somebody who is really having a hard time getting that scar moving and maybe you need a little bit more lift in those tissues, then cupping is also another option. So give those a try, get comfortable with touching and moving that scar. I promise you will have so many benefits, not just for right now and that scar healing, but for down the road too, and preventing things, you know, that it can help prevent back pain and pelvic pain, and it can help you turn on and find your abdominals, so that's always a benefit when healing your core postpartum. So give that a try. It might be a little bit sore in that area after you do it for the first time, and that's okay. If it's really sore, maybe you were too aggressive. So if it's painful the next day or something, or later that day, then maybe back off a little bit in your technique and kind of gradually work your way back to that. But it is okay if it's a little bit sore, have some discomfort in that area, simply because we are moving that tissue and mobilizing that tissue. So it can be sore if we're not used to that, but just monitor that. We don't want you to be in a bunch of pain from it. You shouldn't be in pain. So just monitor your technique. You may have gone too much, too aggressive, and just need to back off just a little bit.